sir.
Hey there. Dexter, nice to see you. Alzo, nice to see you.
Mr. Delaney,
How are you?
you kind of buff, bro. That suit fitting nice.
I probably kept it in the dryer too long. Well, this is a fight after all, right?
Hey,
Wow.
all right.
Yeah.
Okay. What's the deadlift looking like right now?
I don't know. I've been on the campaign trail too much.
Okay.
right.
I mean, you've been posting some of them things
Yeah.
to Twitter, so okay. All right.
It's funny. I'll post something about early childhood education, and it's like no one even notices. But you post yourself doing chin-ups, and it's like, wow, look at that. You get all this stuff. So
Social media.
there's a longer story there.
So let's get right into
All right.
it. So you wrote an op-ed in the Washington Post with the headline, Medicare for All is political suicide for Democrats. But our poll, Vice News poll, found that 68% of Latino voters and 75% of black voters say that it is extremely important that their political candidate, their presidential candidate, also supports Medicare for All. So are these black and brown voters wrong?
No, I don't think they're wrong at all. And I think the problem in this debate is Medicare for All has been kind of conflated with universal health care. So only 3 candidates actually running in this huge field support universal health care. And I define universal health care as every citizen of the country gets health care coverage as a right of citizenship for free. That's my definition of universal health care. Only 3 candidates support that. I support that, Senator Sanders supports that, and Senator Warren supports that. All the other candidates are calling for things like public options and fixes to the Affordable Care Act. The difference between myself and Senator Sanders and Warren is I'm calling for universal health care where people can also have private insurance, which is what most developed countries that have universal health care have, like Germany, France, Australia. They all have these mixed models where everyone's covered as a right of citizenship. But then if you work for a company and they're offering you health care and you'd prefer that, you can opt out of the government plan and get your private plan. And so I think a single payer plan, which means the government's the only payer, the group that covers health care, is political suicide because 180 million Americans have private health insurance. 70% of them say they like it. I just don't think we're going to win any elections telling people they're going to lose something they like. I don't know why we've got to be the party that's taking things away from people. We ought to be the party that's giving something to people that need it. So that's my political view, but also as a matter of policy, the problem is the government doesn't pay enough in health care. So if you go to any hospital anywhere in this country and you ask them how much they get paid from commercial insurance compared to the government for the same procedure, they get paid about twice from commercial insurance than they do from the government. And then if you were to ask them, okay, how would it go for you if all your bills were paid by the government? They'd be like, we'd close, which is one of the reasons health care is inadequate in so many communities in this country, so many low-income communities, because those hospitals have a disproportionate amount of Medicare and Medicaid, and they don't have enough private insurance. And so they receive much lower reimbursement, and they can't invest in the quality facilities and the access. So what I think we need to do is create a universal system, give everyone coverage as a right of citizenship, full stop, for free, but then allow people the choice to choose private insurance if they want. That's my way of, I like to say we should fix what's broken and keep what's working.
So it sounds like there are some parts that you like about the current system.
No, there's nothing, the system's utterly broken, but it's 1/5 of the U.S. economy. And I just don't think the way you make progress is you take 1/5 of the U.S. economy and you throw it out the window and cause huge disruption.
I mean,
What we're better off doing is we have a tragedy of uninsured Americans. And we have a tragedy of underinsured Americans, people who have insurance coverage, but it's terrible. So we should solve that problem by creating universal federal health insurance for free for every citizen. But I don't think we should be pointing out folks in this audience, if I were to say, who's comfortable or likes their health insurance, we ought to be going to those folks and say, well, we're going to take that away from you and you got to now get a government plan, because they're not going to want to do that.
I mean, wouldn't the fact...
Who would want to do that? You wouldn't want to do that if you were comfortable with your health insurance and yet you were having a child, and you wouldn't want the uncertainty of some whole new system coming at you.
Do you think there's something to be said for the people saying that they like it, that there's no other choice?
What do you mean by no other choice?
They have the insurance plan that they have no other choice other than that. So what else would they answer?
Well, this is the way I look at it. My dad was a union electrician. He spent 60 years in International Brotherhood of Electrical Workers Union, which is a great union. And he loved the health insurance that union gave him. And my dad was a lifelong Democrat. In fact, the only political lesson I ever got from my dad was really simple. He would look at me and say, John, if you care about workers, you vote for the Democrat. I mean, he was a true blue working class Democrat. He loved his health insurance. He was so proud of the health insurance he got from the IBEW. Talk about it all the time. And I just know if my dad was still with us and I was running on taking that away from him, he'd be like, why are you doing that? You should definitely give those folks who don't have insurance health insurance. It's a human right. You should definitely be helping people who have terrible health insurance. But why do you got to be messing with my health insurance? So that's why I think it's bad politics. But I also think it's bad policy, right? It's not, it's never going to happen. So I'm actually for doing things that are going to happen. I actually think, I think we can go to the American people and say, oh, by the way, we actually have universal health care in this country right now. It's called the emergency room. Because by law, anyone who shows up at an emergency room has to get taken care of. Now, if we were all trying to come up with the dumbest form of universal health care, that's what we'd come up with. So I think you can go to the American people and say, listen, let's do what we should do. Let's make sure everyone is covered. Period. And then if they want to have other options like their union or whatever the case may be, why are we as a party for taking that away from them?
I'd like to move on to another human right.
Sorry, Dad.
As you would say.
I
No, all good. So
I'm not really practicing for your short answer stuff here.
It's
I
quite
need
all
to
right.
get it better.
You've been cheating.
You're not supposed to know about that.
You're not supposed to know about that.
Well, I was standing back there and listening to Andrew Yang do a very nice job. I don't think I'm going to do better than he just did.
All right, well, we'll see. We'll see. So you're the only one of your peers that has not signed on to support the Family Act, which would grant 12 weeks of partial paid leave for new parents or for any other health reasons. For example, needing to take care of a family member, an elderly family member.
I'm for that. I was on that bill, and I have a proposal now as president. I think paid family leave is that's what you're referring to, right?
This is what I'm referring to.
Yeah.
So correct me if I'm wrong, your platform offers 8 weeks.
Yes.
8 weeks and less pay than other people are offering. Now, other candidates are offering, and some candidates actually are going further than the 12 weeks. They're offering things, 6 months beyond that, right? So, and we know that not having protected access to family leave, to having this, to paid leave, right? Specifically paid leave, is something that people of color take the brunt of, and specifically women of color.
Absolutely.
They take the brunt of this. So how did you arrive at the decision that 8 weeks is enough?
Well, let me start by saying, as president, if an 8, 12, 14-week, 15-week paid family leave bill came to my desk, I'm signing it, right? Because I'm entirely for paid family leave.
But your policy right now is asking for 8.
Right. I think I've got one of the things I've tried to do as president, as a presidential candidate, is pay for everything I'm talking about. And so in the huge list of priorities I have, multi-trillion-dollar infrastructure, creating universal pre-K, massively expanding early childhood education, doing things to compensate teachers more, investing in communities that are left behind, creating a universal healthcare system, expanding paid family leave, I've actually come up with a roadmap for actually paying for all those things. And so that doesn't mean I wouldn't be in favor of bigger things. I'd be in favor of a $3 trillion infrastructure program, but I'm proposing a 2 because I believe that's a reasonable thing we can do and actually pay for.
So you're talking reasonable, what you can do right now?
Yeah, I'm talking about putting forth solutions that work. So, because that's what I think. I think one of the issues in our country is we don't do anything anymore. And so I think you should put forth ideas that make sense, are based on the data, based on the facts, get at the problems we have. You show people how you can build bipartisan support, because that's the only way you do anything in this country. And you actually say how you're going to pay for it.
Well, I mean, we're in the primaries right now.
Yeah.
I mean, this is, for lack of a better term, this is kind of the safe zone. This is where you swing big, right? And we already know what's going to happen is when you put this in front of Republicans, they're going to try to bat it down further. So it almost sounds like you're bargaining against yourself right now.
No, I don't think so. Listen, I think if you look at my policy proposal, if enacted, it would be by far, by any measure, the most progressive step forward in the history of this country. Now, as you said, we all know we're not going to get all these things, but you have to have some defining principles who define who you are. And so would I be in favor of 12-week? I think I was on the bill in Congress when I was in Congress on the 12-week bill. I think I was a co-sponsor of that bill. So, of course, I'm in favor of that.
Let's switch gears here.
Sure.
Mr. Delaney, You spent more than 24 million of your own dollars on this campaign.
10 million.
10. I'm sorry.
10 million.
10 million.
Of your own.
Well, I'm in a place in my life where 10 million is the same as 24 million. so 10 million, we'll go with 10 million. If this presidential run doesn't work out for you, that money is kind of gone into the ether. Couldn't you have used that money for something else?
So listen, I think there's no better thing I can be spending my time and my family's resources, because my wife, April, I've been happily married to 31 years, and my 4 daughters, we're all in this together. I don't think there's anything that I could do that's better than trying to fight for the future of our country and engage in this battle of ideas. You know, April and I, it was funny, when I first started thinking about running for office, because I always thought of my life as a third learning, a third earning, and a third serving. Kind of a simple roadmap. And about 10 years ago, I was running my business, which I started from scratch. I had several thousand employees. It was a public company. And I was thinking about leaving to run for Congress. And I was going back and forth with April and, again, our 4 daughters. Our youngest was only just born. And I'm saying, I really want to do this, but, I don't know. What is it going to mean for us? And she looked at me and she said, it's not about you. And I was taken aback. She goes, it's not about you. You're thinking about this like it's about you. It's not about you. It's about what you can do. It's about what all of us can do. Be in service to other people, which obviously is a wonderful theme on Dr. King's day. And so, look, we've been very philanthropic. We've invested a lot in our communities. And I view this as, we kind of stepped forward in faith to try to make a difference in the world. So, I don't think, I hope, when I see St. Peter one day, which I hope to see him one day, I don't want to tell him about my business career. I want to tell him about what I tried to do to make a difference in the world and leave it better than we found it. So, no, I'm completely comfortable with it.
Well, I guess, and I get when you run for president, you have a platform. Yes. And you have a megaphone and people hear you, right? Yeah. But just practically speaking, right, it costs $55 million to replace the pipes in Flint.
That could be done.
That could be done. Mm-hmm. You're like 1/5 there with your $10 million.
Right.
So why not just go down to Flint, Michigan and be like, I want to help you guys have clean drinking water.
And these are things you believe in.
I totally believe it. And these are things, by the way, these not replacing pipes in Flint, Michigan, but investing in healthcare and education and things in our communities, investing in making sure people have the basic aspects of dignity, housing, immigration. These are things my wife and I have done. We were named the Philanthropist of the Year in the Washington, D.C. area about 10 years ago. So, and even in this campaign, a year ago, April and I went down to the border to a place called Dilley, Texas, which is where the largest detention facility in the United States of America is located. And there were 1,700 women and children being detained there. And these were all people who were seeking asylum. And we went down, and even during this campaign, we said, what else can we do? So we funded a trip where we took 14 law students, 2 law professors for a week to go down there and help the asylum seekers make their case. So I kind of view my service in Congress, my whatever investments in time and money I'm making in running for president, and the work we've done philanthropically as working together. Mm. And so, yeah, I think it'd be great for someone to obviously pay to replace those pipes in Flint. I think the government should be spending trillions of dollars on infrastructure. I mean, we have there's so many institutions in our society, healthcare, education, infrastructure, et cetera, that are biased and discriminatory, where people who are struggling don't get the investment they need, and it perpetuates all these cycles. And infrastructure is a great example of it.
You have, go ahead.
I think that's the time that we have.
Is it?
Yes.
Oh, man.
Yeah, we have.
Wow.
Well, we don't want to monopolize the conversation.
We got some more people who want to chat to you.
Well, you can keep, we have audience members that would love to chat with you.
Hi, sir. So we have Elena. She's a civil rights lawyer from D.C.
Hi, Elena.
Hi there.
All right, so I'm here representing an organization called Be Me Community, which believes in investing in and supporting the Black community and our assets and aspirations. So I'm wondering, how would you invest in our assets, knowing that our homes in Black communities are devalued at $46,000 a home, or that we have more difficulty accessing capital as entrepreneurs? How would you invest in our ownership and in our assets?
Well, it's Elena, right?
Yes.
Well, thank you for the question, Elena. Thank you for traveling from D.C. to be here. So it's a big part of my platform, which is investing in people and communities. I've always had this theory that unless someone invests, nothing happens. And when I was running my business, which focused on lending money to small to mid-sized companies, 5,000 of them all over the country we lent money to, the Obama administration gave us an award in 2008. It's called the Bank Enterprise Award. And it's given to the company, one of them, a year, that they viewed as making the most disproportionate impact on communities that are disadvantaged and left behind economically by lending into those communities in an ethical manner, which is something I was very proud of. So I kind of did some of this for a living. And I think what we need is a transformative amount of investment in not only housing, but in particular in entrepreneurship. So some of the things I'm calling for is to create a new federal banking charter to allow for nonprofit banks. Nonprofit banks are not allowed in this country. To allow philanthropists and social entrepreneurs to actually run banks in communities that need banking services. I'm calling for the creation of a new investment program in the SBA, in the SBIC, where funds are created that have to lend to minority-owned businesses. I'm calling for new disclosure among publicly traded companies where they disclose their percentages of minority contracting to create more transparency and more of an incentive for big companies to contract with smaller minority businesses. Those are the kind of things. I think as part of a national infrastructure and as part of my $120 billion affordable housing plan, we need a disproportionate investment in communities. I mean, this actually struck me pretty personally, I guess about 6 or 7 years ago when I was first in Congress. And I was in my committee, it was called the Joint Economic Committee. And I was reading a report on the economic conditions of African Americans. I think I was the only one on the committee to actually read this whole report. And it had all the negative statistics you'd expect: wealth, income, housing price inequality, statistic after statistic, there's a huge gap. But one stat really struck me. And it said that if you're born in the bottom quartile economically and you're white, you have a 4 times greater chance of making it to the top quartile economically. And it hit me because I was born in the bottom quartile economically. And I worked hard. You know, I started these businesses from scratch. And I felt really good about my success. But then I read this thing and I said, it was just a lot easier for me. And I probably had much easier access to capital than someone just like me with the exact same idea, the exact same set of skills, who was black.
And in fact, if you're black and middle class, you're more likely to fall out of the middle class.
Absolutely.
Yes.
And this all gets to how we allocate capital in this country. We're just not allocating it to the people who need it, to their communities and to the individuals. The way we fund public education in this country is the most racially discriminatory institution in many ways we have. You could say the same thing about healthcare. You could certainly say the same thing about small business formation, entrepreneurship, those kind of things. If we actually want to create a society where these statistics all look the same depending upon the color of your skin, you've got to invest in the people and in the communities.
Can I ask one follow-up? Really quick follow-up is, how do Black-owned banks and CDFIs fit into your plan? So
I'm a big supporter of CDFIs, but I think we need to do more. So this thing about the banking thing, I know it seems like small ball, but it's a big deal. Under our banking laws, banks have to be for-profit corporations. So if you and I were running a bank and we were to set it up in an inner city as compared to in a wealthy suburb, it would make a lot less money because the people in a lot of these poor communities don't have big balances, they don't get big mortgages, they don't get insurance, they don't do all the things that banks do to make money. And a lot of their customers aren't as financially literate and they need more handholding. So that creates a disincentive for anyone to set up banks in these communities. CDFIs are great, but there aren't a lot of them, and they're pretty small. Whereas you go to all these philanthropists around the country who invest in microloan programs, they invest in housing programs, they invest in all these things in communities that need investment. But the people they're trying to help are still disconnected from the modern economy because they don't have real banking relationship. They go to payday lenders, they go to title pawn, they go to all this horrible stuff, and they just get ripped off. What I want to do is create nonprofit banks that allow philanthropists to invest in them, and then they can operate with kind of a different headset in terms of the services. And I've talked to philanthropists all over the country. There'd be a huge demand for this. But these are some of the things that are actually tactical and specific that would make a difference.
Thank you, sir. Thank you. I'd like to sneak in another question.
Sure.
We have Amanda here. She's a student from Des Moines.
Hi.
Hi, Amanda.
Hi. Do you support increased funding for mental health awareness, diagnosis, and treatment in public schools? And how will you make changes and prioritize mental health care affordability and accessibility during your term?
So mental health is an issue that doesn't nearly get discussed enough on the campaign trail. We have an absolute mental health crisis in this country. And all these other issues that we talk about, you often find mental health behind it. And it's affecting everyone. We see it with veteran suicide, all the way down to the crisis of anxiety in our schools, which is just escalating out of control. Depression, anxiety, a sense of loneliness. There's a lot of reasons for it. Social media doesn't help. My wife, who works in an organization called Common Sense Media, does a lot of work on this issue. And the reason we have this mental health issue, in my opinion, is because we discriminate against people with mental health because we stigmatize it. So 40 million people in this country say they have a mental health illness. We know it's a lot more than that. And we need leaders who are not ashamed to talk about the fact that we all have mental health in our family. No one should be ashamed of a mental health illness. Mental health claims are 4 times more likely to get denied than physical health claims because we allow this stigmatization. So the big problem is we don't reimburse mental health providers enough. So not enough people go into the profession. So what I'm in favor of is a massive expansion of community health centers where we actually have mental health professionals on staff. I'm in favor of increasing Medicaid and Medicare reimbursements for mental health professionals. That'll attract more to the field. And I'm certainly and absolutely in favor of mental health professionals in our schools. Because what's going on with teens, particularly young girls, is a crisis, an absolute crisis in this country.
Thank you, sir.
Thank you.
Thank you, Amanda, for that question. Alzo, take us back.
So
how we doing?
We're doing fine. How you guys doing?
I'm doing all right.
So since you cheated earlier,
Oh, come on.
You already know what's coming up
I
next.
was following the rules. I was standing back there, you know? They tell you stand here, stand here. Don't trip on that little ramp when you come out.
Yes, yes. So you know what's coming up next then? You didn't see
Should I
that
act
backstage.
surprised?
Yeah.
Act surprised.
What's coming
please.
up?
There it is. The short answer.
The short answer.
So,
The short
you have
As you can tell, I'm not skilled in the short answer.
Yeah, we witnessed a little bit of that just
Yeah,
now.
you saw that. They're sitting there saying this whole short answer thing's going to go really badly for Delaney.
60 seconds.
All right.
Answer as many questions as you can, and we'll pray.
Yeah.
So, what is the last concert you went to?
Bruce Springsteen. I've seen 30 of his concerts.
Softball. Fill in the blank. Allow me to reintroduce myself. My name is...
I'm the husband of the amazing April McLean Delaney.
What emoji do you not understand?
98% of them.
What state has the best barbecue?
I think D.C., which is not a state, it should be. It will under my presidency, has great barbecue. I think Tennessee's got good barbecue.
Do black people deserve reparations?
Yes, in a form that we have to figure out.
How much does a gallon of milk cost?
About $3.
What's your jam right now?
I listen to country music and Springsteen, so.
Springsteen is a theme here.
I know. I'm from Jersey.
See, the time's up and you still answer.
I'm still going.
Won't
How
obey
you
the
do,
rules.
folks? Mr.
I
Delaney,
think they just feel sorry for me.
thank you very much.
Alzo, thanks.
Appreciate you.
Yeah,
All right.
thank you.
Oh, man.
Thanks for the good questions. I
Absolutely.
appreciate it.
Appreciate it.
Thanks, everyone.